Welcome back, viewers. In our last video, we talked about pre-diabetes and its prevalence in India and how the pre-diabetes is diagnosed. In today's video, we are going to talk about the symptoms and signs, risk factors associated with pre-diabetes, and the modalities of how to prevent pre-diabetic patients. So, my first question, Dr. Yuvraj, would be: what are the risk factors associated with a person who is likely to become a pre-diabetes?
Yeah, this is very important to know. See, generally, pre-diabetes, diabetes, hypertension, overweight are all lifestyle disorders. We know that.
Yeah.
So, some of the risk factors are common for all these issues. Like for pre-diabetes, diabetes, or hypertension, but I'm talking about pre-diabetes. But diabetes is similar. Like we start with higher age, 30, 40 plus. Male sex, male patients are more prone to be diabetic. Your accumulation of fat, if your fat percentage is more than 20%, 30%, especially waist fat, the belly fat. If your waist size is more than 40 inches in males, more than 35 inches in females, the likelihood of developing diabetes is more, or pre-diabetes is more.
I see.
So, moving on to family history of diabetes. If a guy has his sister, elder sister, or father diabetic, or if a lady has his mother and father both diabetic, the risk factor for diabetes is more. So, family history of diabetes, your overweight, and your belly fat is more, male sex. Then coming to other specific, a female having polycystic ovarian disease, she's more prone to have pre-diabetes. A female in pregnancy developing high blood sugar or diabetes called gestational diabetes, she's likely to be either the pre-diabetic range or diabetic range. Then patients having typical symptoms of metabolic syndrome, which are having high blood pressure, high cholesterol or high triglyceride levels, and overweight or hypertension. So metabolic syndrome have high belly waist, high triglycerides, hypertension. These are in having more propensity to become pre-diabetic or diabetes. If you measure their sugar levels, they may be generally in pre-diabetic range. So that is a point, alarming state where patients should take care of.
I see. And are there any visible signs in the body which tell that you are getting pre-diabetic?
See, for diabetes, we have many known symptoms like thirst, fatigue, lot of hunger. But in pre-diabetes, may or may not be there symptoms.
Okay.
Generally, it is symptomless. But there's some, strangely, there's some signs. But high blood sugar, there's some signs, especially in the skin. Something called skin tags. Like I have these skin tags.
Okay.
And darkening of the skin in the neck area. It is called Acanthosis nigricans. Acanthosis nigricans. Darkening of the skin in the neck, armpits, elbows. This is one of the signs. And having, as I told you, 40 inches
Yeah.
waist for you guys, and also skin. These are some, and triglycerides are very high, abnormal triglycerides. So these are some symptoms of that, and high insulin levels.
Okay.
These are also some
Signs.
signs where patients can be having pre-diabetes.
Okay. Suppose it is diagnosed that a person is pre-diabetic. So, what are the modalities now to person becoming a diabetic altogether? How in other sense we can prevent pre-diabetic stage?
Okay. So prevention and treatment of diabetes is similar except medication. So many patients may not require medication. So, but preventing diabetes or managing a diabetes same. Reduce your weight, exercise. Exercise is must. Food management, decreasing carbohydrate in the diet like rotis, breads is important. Number 3, if you are sedentary, start moving. Number 4, reduce stress. Sleep on time. Do not awake in the night, and take proper rest. So main is food, exercise, and lifestyle management. So they will prevent pre-diabetes.
Wonderful, doctor. Thank you so much, doctor. And this is what we are concluding with. Now, in our next video, we are going to talk about reversible factors which can help us in reversing the pre-diabetic stage, and more on this in our next video. Thank you. Stay in touch with us.